Good morning. It's Tuesday, July 27th. I'm Jessica Lovell. Welcome into the morning medical update. Today, we are talking about COVID, long haulers, and their symptoms. Long haulers can struggle for months after being diagnosed with COVID-19. And today, we talk with one young mom who has suffered more than a year and the worries that she has for herself and her family. Dr. Stites, of course, is back with us today. How are you?
Great, thank you.
All right,
Happy
glad
to be
you're here. Yeah, and we're glad that Dr. Brandon Comfort's also joining us, too, to talk about long haulers at our clinic. He joins us with the 3 most common complaints that you're hearing right now from those long haulers, right?
That's right.
All right, we're going to get to those in just a few moments. But first, he's back.
Yeah.
Dr. Hawkinson joining us with our numbers. Good morning. How was your trip? We have to at least ask that.
Yeah, it was good. You know, spent a lot of time outdoors, so that felt a lot safer.
Are you relaxed? Relaxed? You come up refreshed?
Relaxed a little bit. You know, again, had a family function, a funeral yesterday, but luckily, everybody up there, 90% or more of people were vaccinated, so that was healthy and did it in a good way. But
good.
Now ready to get back.
Well, our numbers are up, so we're ready to put you back to work. What do you got?
Yeah, I saw that when I went away, the numbers went up. So
yeah, you should have been here. You got to keep the numbers down.
So first of all, starting off, apparently Hayes had 1 or 2 inpatients yesterday. They have 5 today, with 1 in the ICU, and that patient is intubated as well. We here at the health system have 37 active infections, with 17 in the ICU and 10 on the ventilator. We still have a 23 with that additional recovery period as well, so not the active infections. Our last death was 7/26, July 26th. So, it's still very real, and we know that our cases continue to be very high.
And that death, that's just like yesterday. So, I mean, that was just today is the 27th. So things are tough, right? Yeah. They're tough out there, Hawk. And any thoughts that you have about this rise and things we could do besides, masking and vaccine looks to me like the way out of the crisis.
Yeah, I feel, got to think about this a lot as I was away and still kept up with the news and the literature. This continues to be such a behavioral disease at this point. The cases are on the rise. Is Delta variant more fit? Does it spread more easily? Well, I think the big thing to remember is there's no mandates, there's no masking, there's no restrictions on anything. People are able to do what they want to do. So I think that contributes a lot to this spread, this prevalence of the disease, the increased cases. But the way to stop it is through vaccination.
Yeah, I think that's exactly right. And I think one of the things we need to be nervous about is the lack of vaccine in so many areas and the lack of change in public behavior thus far regarding masking. I had occasion to make a trip down to Springfield and back, and there's just, first of all, there's not a lot of masking in Kansas City, and there's not a lot of masking yet in Springfield. And I think at some point, if we're really going to be able to stem this rise in the Delta virus and not continue to be the epicenter for this outbreak, this 3rd wave in the U.S., we're going to have to look at those kind of things and encourage people to get their masks back on and to make sure they're doing those same things that we knew help lower our numbers down to 2. Remember, we were 2 in March, and we didn't have anywhere near this many people vaccinated. And so the rise in this is a question of A, not enough folks vaccinated, and B, not enough social distancing and masking. That's clearly been the change in our situation along with the rise of the Delta variant. And what we have to remember is other variants can arise if we're not careful and if we don't stem this tide now.
Yeah, and I think, having traveled and a little bit of personal experience here, understanding why is this continuing to go on. So there is a subset of the population and a group of people, probably in any area, but who still are very thoughtful about this. But I think the misinformation campaigns have gone on greatly and contributed to this a lot. Infertility fear is one thing that I continue to hear. And these are people who are otherwise smart, who want to do the right thing, but who just don't know and understand at this point. So there is that subset of the population who isn't vaccinated because of legitimate fear or thoughtfulness about that. And then, of course, there is there are other subpopulations who, believe this is a hoax. I saw an article today in Washington Post. I don't understand what the hoax is. What exactly you're talking about the hoax? The vaccine giving protection, the virus itself, all the tragedy and death that has come and will continue to come if we don't do the right thing. So I think there are a lot of reasons, and we have talked about this before, there continue to be a lot of reasons why people still do not want to get vaccinated, but we have to continue to give that message, especially to those other thoughtful groups of people who really want to do the right thing, but are fearful because of those misinformation campaigns that have gone on.
Are you all concerned? You know, the FDA has come back and said for those between 5 and 12 years old, asking for more patients to be enrolled from Pfizer and Moderna, more data to come out. I think they're trying to make sure there's nothing to this myocarditis issue and pericarditis that can occur. Do you have concerns about that? What's your sense about where we're headed?
You know, I still believe these mRNA vaccines are very safe. No long-term side effects. It doesn't alter your genetics or your DNA or anything like that. I think their main reason, and this is because they don't want to get caught off guard, because we've seen this happen with some of the younger age groups that they have originally, the 12 to 17 or 12 to 16 age group, where they did see that myocarditis. I think they are just really trying to look for any of those rare events that may occur so that they can face those head on and be transparent, because that has been the story with these vaccines from day one, is the transparency. So I'm not concerned about the vaccines and the side effects, but just more concerned about the FDA wanting to understand, you know, are there those rare events, and can we be transparent if there are?
Well, actually, I think it's a good sign the FDA is doing this, because here's what I think. I think we're going to find out there's nothing to this, and that we'll be okay. But for those who believe that the FDA has rushed this too much, this is an example of the FDA not rushing. What the FDA is doing is saying, look, there are a few signals here around myocarditis. We just want to make sure before we tell everybody between 5 and 12 and younger that it's okay, that we're going to make sure that it's okay. So it does mean we'll probably not have those results until middle of October to early November, as opposed to early September when we had hoped. But I'm okay with that, because what it's really saying is that we're going to make certain that the vaccines are safe for young people. And again, the FDA is not rushing that. Good news, I think it's the right thing to do. The second thing I would say is we already know what can keep us safe, right? We already know what keeps us safe, because remember, again, in March, we had about 18 to 20% Delta virus there and some wastewater testing, I think. And in March, what we found was that we got our inpatient numbers down to 2 because people were masked and practicing social distancing. Now we've got a lot of folks vaccinated. Vaccination works. And we know we can still go back to practicing social distancing and masking. So I think it comes down to the same choices. We have a choice to be made. And the choice is, do we take the risk, or do we make sure we keep everyone safe? Clearly here in the hospital, we believe in keeping everyone safe, in part because we don't want a bunch of long-haul syndrome, which I know we're going to be talking about in just a minute.
All right, let's get to some reporter questions. I think we have someone on the line.
Hey, good morning. Cody Holyoke with Channel 9. Real quick, Dr. Hawk, you mentioned the numbers today. I saw 10 on the ventilator. That seems fairly high, sadly. What are you seeing in the patients? Any correlation there? I'm just curious.
Yeah, you know, we don't have the demographics of those patients, but certainly 17 in the ICU with 10 of those on the ventilator, more than 50% on the ventilator. You know, it is concerning. I don't know the last time the demographics were given.
Yeah, we did it last week, and I'll just say that initially we were hoping that we weren't seeing quite as much severe illness with this virus, but we are starting to see more of it now. As when I say this virus, I mean with a Delta variant. But I think what we're doing, and what we're seeing now, is that the numbers are starting to track with what we've heard worldwide, which is people aren't necessarily sicker, but they're just as sick. And I think that's what we're seeing in the rise in the ventilator. And so it is a concern. I liked it better when there were 3 or 4, but what's happened is the demographics have caught up with us. As we've gone further into this, what we know is that it's starting to act just like it did last fall. A, the big rise in cases. B, we're going to continue to see a rise in ventilators. What's different, and we just have to acknowledge this, what's different is we're not getting the nursing home patients.
Yeah.
So our ventilator cases, by and large, are a little younger now than they were before, but we'll come forth with those clear demographics here sometime, probably toward the end of this week.
Yeah, and if you remember also, going on the ventilator is one of the last steps our ICU physicians want to take to doing that. So when you do get on the ventilator, it is because of severe illness.
Yeah, it's almost always COVID-associated pneumonia.
Yep.
Other questions?
Yeah, just a follow-up.
Please.
You mentioned the talk about masking, and it's still very much a political debate. What I'm seeing is, even from viewers and even just people online, and even from Missouri's governor, that it seems to be an argument that it's a binary thing. Why do the masks if we've got the vaccine? Mm-hmm. Can you tell viewers about the importance of having both? You mentioned it a little bit, but I'm curious.
Oh, you bet. So we don't have the vaccine, right? There's a whole lot of Missourians who aren't vaccinated yet. Mm-hmm. So when we may have the vaccine, but if it's sitting in the pharmacy and not in your arm, well, then you don't have the vaccine, right? And so I think that's the first problem. The second thing is, even if you've been vaccinated, you can still spread the Delta variant or any coronavirus. Now, the risks of spreading are down dramatically, but if you're vaccinated, but you still have to remember you can still spread it. And in this time where we see a lot of unprotected people, what it means is we have to ask each other to do something. First, we have to ask those who are unvaccinated to get vaccinated. I think you can see that rise in frustration in the vaccinated community saying, gosh, we've done our thing. You guys haven't done your thing, and you're costing us trouble. So please go do your thing. Go get vaccinated. But second, I think we have to say to each other, we all need to put our masks back on until we can get you vaccinated. Because once we achieve, and it's probably up to 85% vaccination right now, which is approximately a very high number, but can I point out to you that those over 65 are over 80% vaccinated, and at 90% at least one dose throughout the United States. So don't tell me that it's not possible, because those over 65 have made it possible. They've done it. They have hit the threshold that we all need to get to. So that means all of the rest of us have to get to 85% vaccination, which means we're also going to have to eventually vaccinate young kids. So that's the chain of events. But what it means is we're going to have to wear masks until we get ourselves up to that number to really be safe from the Delta variant. The thing we have to worry about the Delta variant is it's really bad, and in addition to that, right now we're seeing the rise in parainfluenza virus, we're seeing the rise in RSV and those other things that go along without having masks on. And we know that the Delta variant already we know is going to be associated with long haul syndrome, which we're going to talk about. So the key here is, yes, get yourself vaccinated. If the 65 and overs can do it, so can you. And two, put your mask on anytime you're going into public spaces or out around folks, because the reality is we got our numbers way the heck down when we had just started vaccinating and we still had social distancing and we had masking. The difference now isn't a failure of vaccination. It's because we forgot that the rules of infection prevention and control travel with us wherever we go. They keep us safe. They'll keep us safe. And they'll keep us safe.
Other questions?
Hi, this is Savannah Rudisell from KCTV5. We've heard that the Delta variant is more transmissible than the original strains we saw from Wuhan. Is there any way to quantify that? Do we know how much more transmissible this variant is?
We do.
Yeah, I mean, I think we should start with, transmissible is a big word that could mean many things. I think a better word is probably, what is the fitness of this virus? Is it more fit for some reason? Is that why it's more transmissible? Meaning, do you replicate more of that virus in your upper respiratory tract so that when you're breathing or yelling or singing, you're getting more of the virus out into the environment? Does it mean that you replicate that longer in those higher viral loads? We just don't know that for sure yet. There is some signals that you do replicate more in your upper respiratory tract. And also, what are the other components of that virus? Are they reducing your innate immune response by some of those other genes that may be mutated? So I think fitness is maybe a better word. Is this virus more fit? And for that reason, is it able to be transmitted easier? We don't know those full answers, but again, some signals from the data do suggest maybe you do replicate it longer, maybe you do replicate more or higher viral loads. But again, I think the main issue is, again, still that behavioral issue, and that is just we as a society now have no mask mandates. We have no restrictions. We're basically out doing things as we were pre-pandemic, and that adds a lot to this. There are people, getting together in large crowds or going to parties or doing things indoors. I think that is the main contributor at this point in time.
And Hawk, there was some stuff that came out last week about the R0. The R0 is how likely is one person to infect another person, or if you have it, how many people are you likely to infect? And the answer for the Wuhan strain was 2 to 3 folks, and that's a pretty high R0 actually compared to influenza and most other transmissible diseases. The Delta variant is supposed to be about 6 people, 5 to 6 people, which makes it 80 to 100% more infectious than the Wuhan strain. So the problem with the Delta variant is because it can spread more easily, it takes less time to be in direct contact. Remember the good old freezer videos that Hawkeye and I did last year without masks on? And we said, look, if you're around somebody that has the original strain and you've been there for about 10 minutes, your chance of getting infected is X. And it was about 50% or whatever. So now it's forecast that time is probably much shorter. I'm not sure we know what it is, but in order to have an R0 of 6, it means you're not being as exposed to people for as long. The second question becomes, whereas 99%, it looks like 99% of infections with the original virus were spread indoors and very few outdoors, we don't know about the transmissibility outdoors on the Delta variant, especially if you have a close contact. Because if it takes less time and you're up close to somebody and you're in a crowd, like a rock concert, let's say, where people are yelling and screaming or whatever, or you're at a whatever event where there's a lot of cheering, and you're putting out a lot of particles into the air. Can you get other people sick outside where you probably couldn't do that very easily with the original strain? Not clear that that's still true. The Delta virus may be more spreadable, or the Delta variant may be more spreadable.
Reporters good? Okay, we are going to work on getting your community questions, so get those written and get those in. We're going to get back with you, Dr. Hawkinson, here in just a moment to get some of those answered. But I want us to meet our next guest, Heather. She has been experiencing long hauler symptoms for more than a year. Heather, so glad you could join us today, at least by phone. I know that you were kind of on the fence about sharing your story with us. Why was it so important for you to share what it's been like for you over this last year?
Hi, good morning. Thanks for having me today. I think that I am ready to share my story more just because it's becoming more and more likely that I'm going to have a lot of people in the same club as me with having ongoing symptoms since they were originally ill. And we just need to come together and try to not only prevent it from happening to more people, but to bring more awareness to ongoing problems that come after COVID so that we can hopefully get more help.
So take us back a year, March 2020. You're a nurse. You're possibly exposed. You're treating people that may have been exposed at the beginning of this pandemic. When did you first know that there was an issue?
Yes, I'm a nurse, and right whenever we started taking COVID seriously, I was working some of the screening stations at the hospital, kind of before mask mandates really started. And about a week after doing those screening stations, I developed shortness of breath, where I just felt like I couldn't get that deep, satisfying breath. And shortly to follow, there was an 8-day period where then I started having chills, and then a low-grade fever. And then a few days later, I started getting extreme tachycardia or high heart rate, which would basically go up to 150, just making my kids a sandwich standing in the kitchen.
You told me you were seeing a pulmonologist, a cardiologist, a rheumatologist, an infectious disease doctor, and a hematologist. Classic long hauler needs. Tell us what you're experiencing now. And I know we have some photos because I want to show those. Let's just start with some of the issues you're having with your eyes.
Yes. So there have been about a dozen other symptoms in the last year that have came and gone. I still have the occasional shortness of breath and tachycardia. My eyes always look like I have 2 black eyes under them. They're always dark like this now. That's a new thing since having COVID. I also have like poor circulation in my hands where my fingers, just doesn't look like they're getting circulation to them at all. And it obviously has the appearance of Raynaud's, which is, again, a new finding since in the last year. When I'm cold, as you see in the picture, my fingertips will turn blue now. All of this is brand new. Before I got sick, I was a very healthy, fitness-obsessed mother of 2 young kids. And it's very hard to even take a walk now without my heart rate shooting up to 150, 160, when I used to be able to run 5Ks a day and my heart rate wouldn't still even get up to that high what it does now when I'm walking. So in the last year, in a desperate need for trying to return back to my normal health, I've seen a pulmonologist for my breathing, a cardiologist for my heart rate, a rheumatologist for my fingers, and then a hematologist. I've had a consistent low white blood count in the last year in the 2s and 3s, and a high D-dimer. Those are really the only 2 tests out of everything that are coming back somewhat abnormal, which has been frustrating because I feel far from normal.
And Heather, your young daughter's having some of the same symptoms that you're having, right? How old is she?
Yes, she is 4. She was 3 when she was sick. She didn't have any signs of the illness when I did, other than we did find a picture a week before I got sick where she had an upset stomach. So I'm not sure if that was it or maybe she was completely asymptomatic. But over the last few months, she has developed kind of the same symptoms I have with her heart rate is getting up pretty high when she's playing, and then she has to stop because she's short of breath. Her eyes look just like mine do underneath. And then she just randomly started developing these rashes on her body out of nowhere as well. So I worry that she has the same ongoing things I do.
You're vaccinated now, though, right? Has that had any impact on the symptoms you're having?
Actually, it has greatly improved my shortness of breath and high heart rates once I got the vaccine. I was a little worried about what it would do with my overall health, rightfully so, but I am so thankful that I got the vaccine, and I honestly wish I could get another booster to take care of my last remaining symptoms. But the vaccine did greatly help my shortness of breath and tachycardia, and my husband's been vaccinated. Obviously, my kids are too young to be vaccinated, so we're hoping we can at least help protect them.
So glad you got the shot. I want to ask you about something else, and you were pretty open with me about this because I know that this is you being diagnosed and having all these symptoms has caused quite a divide with your family. And I know there's a lot of people out there going through the exact same thing that you are. What has that been like? Maybe you could offer some insight or advice to people going through the same thing with this divide.
Yes, and it's family and friends, and it's one of the reasons I was a little nervous about talking today is I'm almost embarrassed to still be sick. Like, I'm ashamed of it. And people don't understand that if they've not personally experienced it or been through it. So with the divides, I'm very cautious about ever getting this again. I don't ever want to go through something like this again. I don't want my kids to experience this. And I'm still, worried about my daughter. So we're very cautious still with being around large groups of people. We have been vaccinated, but we're still wearing our mask indoors. And then on the other side, I have very close friends and family that are the complete opposite of that. They don't, want to wear a mask. They don't want to get vaccinated. And it's been very hard on relationships in the last year and seeing things from both sides, because understandably so, they don't see it from my side because they haven't had to experience it. And I hope they never do. I wouldn't wish this on anybody, but it's been very difficult for us to feel safe around our own closest family.
Well, we appreciate you sharing this with us. Stay close. I know the community is going to have some questions for you, but of course I want to bring in Dr. Comfort on this. I mean, people will say, well, you may get over COVID, but then you may be left with symptoms like Heather. How rare is this, or how common is this?
Yeah. Well, first of all, thank you to Heather for sharing that. That takes a lot of courage. We've been hearing that story over and over again in our long COVID clinic here at KU. And so I'm glad the message is getting out. It's difficult to answer how many people are getting this. There's been several studies out there. They're a little bit, they're all structured differently, so our data isn't very good, but it's probably somewhere in the neighborhood of about 10% of people are having some form of post-COVID conditions after they get sick from COVID-19.
And is it you're seeing them have one or two symptoms, maybe one, or like five or six, like Heather?
Yeah, the fortunate ones, if we're going to say that, they have one or two symptoms, and they may be relatively mild. But unfortunately, there's a lot of people out there that they're having, just like what Heather described, multiple parts of their body, multiple organ systems are involved, the heart, lungs, fatigue, et cetera. And so most people that we're seeing anyway are having a whole lot of different symptoms.
So what are those three main symptoms of people? What are the three main symptoms that people are complaining about? Shortness of breath? What else?
Yeah, so shortness of breath, that's probably the second most common that we're seeing. Fatigue is the most common. And the fatigue that people are describing is a very debilitating, profound fatigue. Very difficult to do, a full shift of work, very difficult to take care of young kids and those sorts of things. Respiratory issues are our second most common. So cough, shortness of breath. Our pulmonary department has been very busy fielding a lot of those questions. And then for us, we're seeing a lot of cognitive issues. And so this brain fog that we're hearing about, we're having a lot of referrals come in for brain fog.
Dr. Seitz, what are you seeing as far as patients go and long haulers?
I actually have a question to him. Can I?
Yeah, go for it.
So I think all the things you've said, I've heard some higher and lower percentages, but are you seeing it in anybody that's been vaccinated?
So far, so there's a big delay on this. So we're only seeing patients that are having symptoms beyond 12 weeks. And so I have not seen anybody yet that has that developed long COVID after being vaccinated.
So one good thing may be that vaccination is going to prevent that. And second of all, Delta virus. Now that's been a Delta variant. It's harder to know that because that would have, we could have only been pretty sure over the last 6 or 8 weeks that so I wonder about what you're reading about the Delta variant.
Yeah, so we don't know that it's going to increase the odds of getting long COVID, but I think as the numbers rise, just like we're talking about with the hospital, I think we can certainly anticipate more long haulers here in the next few months.
And here's what you don't want, folks. You don't want this. And I think there's an easy answer. And the answer is exactly what we tell you every day. It's get your vaccination, practice the rules of infection control, and wear a mask, right? Those are not really that hard. It's funny. We've made masking this really big deal because it's just so awful. Really? Is it really that awful? What's that? Is it really that awful? Because is it what's more awful? What you just heard about Heather and what she's suffering from, or just wearing a mask? Because all you have to do in that mask, you just kind of pull it up over your face, you wear it for a while, you get home, you take the mask off. But when you're out amongst other people, you put the mask on. And yeah, it's not what we like, but how bad is it really compared to the things that Heather's had to say?
One of our viewers wrote into me, she's like, I never knew a tiny little piece of cloth could cause so many problems in our society.
Yeah, right? I'm always so shocked. You say, well, you can't tell me what to do. Okay, well, wait a minute. You go into a restaurant. What does it say on the front of the thing?
Yeah.
No shirt,
yes.
No shoes, no service. Now what it all says, no shirt, no shoes, no mask, no service.
Right.
Because how hard is it really? You got to wear a shirt and shoes when you go to a restaurant. What is it we're really fighting about? Are we fighting about being told what to do? Are we fighting a national political battle? Or are we fighting against COVID-19, who's a common enemy to all of us? Really? What's the fight about here?
Right.
Who is the enemy? Is it each other or is it COVID-19?
Yeah, I totally agree. I think it's, maybe reducing the myopia a little bit.
Are you saying we got to have better vision?
Yes. More vision than just ourselves. Maybe even compassion for the children, because we know children can get long haul symptoms as well. We know that symptoms can last for a year. A small study recently published, again, a small study, but 70% of those patients had at least one symptom up to 1 year after getting COVID-19. And it's all the symptoms you talked about. It's that reduced exercise capacity or shortness of breath, that brain fog, the fatigue. And if those are lasting up for a year in adults and it's difficult to do a daily thing, just think about the children when they're having these symptoms as well. So
I'm glad you're here because he always uses really big words, and so you're here to help me break that down.
He's just smarter than I am.
I know, he's smarter than all of us.
So.
What are we going to do? All right, I do, Dr. Comfort, as you heard Heather talk about a little bit, this is causing quite a financial stress and an emotional stress and people missing work. And you talk about the fatigue. They can't put in a full day. What kind of support is out there for people dealing with these long haul symptoms?
Yeah, so there's clinics like ours. People's primary care physicians as well are probably quite familiar with a lot of these symptoms. And so what we're doing in our clinic is, we're supporting all of our patients through their recovery period. And so by and large, this is really a condition where rehabilitation services are really our best friends. So physical therapy, occupational therapy, speech therapy even for some of our brain fog symptoms, and we're going to kind of guide those patients through that. So that's the main levels of support that we've been providing our patients.
Can people get better? Do they get better?
Yeah.
What
Fortunately,
what
yeah.
percentage of people are getting better, and what percentage of people are staying the same?
So almost everybody seems to be getting better over time. It's exceedingly slow, and it's hard for people to kind of go through this for months on end, up to a year or more at this point. But most people are getting better. We think it's going to be a real small percent of people that end up having chronic symptoms beyond, a couple of years or more.
So is a story like Heather's then good news for people who maybe have had it, did not get vaccinated? If they get vaccinated, their symptoms might get better?
For sure. So we are hearing reports of that. So there's no firm data on that, and it's very anecdotal. But I'm having lots of my patients in the post-COVID clinic will tell me that they get better after getting the vaccine.
How many how many shots should you get, Hawk? I wonder if to treat post-COVID syndrome. Is that going to be a prescription you're going to write?
Right.
Q month for 6 months or something?
Well, I mean, again, we know that mRNA vaccines are safe. We know people who have gotten who were in the trials for some of the trials early on, but then once vaccines became available, went ahead and got mRNA vaccines. We've seen the stories about other people who have received more than one dose. The mRNA vaccines are safe. How many do we need? I think that's a good question. Right now, there's no more guidance. It is those 2 for the full dosing for the mRNA vaccines to get. So, once we get some more information, we may need an additional vaccine or dose down the road. But right now, those questions are being investigated.
Docs, can we get to some community questions? All right, let's do it. Jill, let's get started.
Good morning. Beth has our first question. She wants to get some clarification around yesterday when we were talking about, do you get kids tested or not? A lot of kids are getting sick right now. Should they take them in for a COVID test?
I don't know what they said yesterday because I'm guilty.
Yeah.
I haven't watched the program yet, so I'm just going to I think we'll just say what we say today. I think the question is you should. I would lean toward getting people tested because I think you want to know what the risks are for spreading COVID to others, and to let people know if your child has COVID, who they've been in contact with, so that they can notify their folks.
Yeah, I think you start with getting your child or anybody in your household, if they have symptoms, tested for COVID. After that, then just be aware that we are seeing a rise in the pediatric population of those other respiratory viruses, such as RSV and other of the common cough and cold viruses as well. But I think it starts with at least getting tested for COVID-19.
Yeah, on the RSV point, in fact, Dr. Stites, in your phone I sent you, there's a Kansas alert on that if you haven't had a chance to look at it.
I have. And we are aware of that because there's been so much RSV out in the community. There's been so much parainfluenza now in the community. And both of these are tough viruses, and especially if you've been immunocompromised, they're bad viruses. So I think what we're seeing is that these are far earlier than we would normally see them. So something about the infection dynamics out there, people will write about this for years to come. But there's clearly a big rise in RSV and a big rise in parainfluenza.
What are the RSV symptoms in kids?
It's a cold. You get sore throat, you get a cough, you get chest congestion. What's bad about RSV is it can get into your lungs and you can makes you have a hard time breathing, as can parainfluenza. And when you get like that, some kids are hospitalized. So I think children's we've heard yesterday, was really full. It's been full for a while now because there's so much RSV and parainfluenza in the community.
Yeah, and I think this reinforces just the nature of what we talked about earlier, the behavioral aspect of this infection. It's not just this infection, but it's those other respiratory viruses that we now have seen made a comeback as well.
So Vicki says, I am so sorry, Heather. Also, thank you for sharing this awful experience and for your service to others as a medical professional. What can you say to address the belief that this is just a virus and viruses have been with us forever?
I would say that long-term complications after having it are very real. There are this number is growing. You don't want to be a part of this club. One I never signed up for. It hurts me more that I think my daughter's a part of it. So if you want to do your best to protect yourself from having long haul symptoms or the people you love around you, then get vaccinated if you're able to. Keep your mask on, social distance, and just take what the medical professionals have been screaming for the last year seriously.
I like that, seriously. Can I just say, when you look at viruses, Brandon, that people get sick with, they come into your clinic like influenza or RSV and parainfluenza, things like that. The percentage of people who have long-term side effects is vanishingly small, right? It's like less than 1 in 100, less than 1 in 1,000, 1 in a million. I mean, you think of the really bad viral complications like Guillain-Barré syndrome, which is a loss of strength in your body. That is 1 in a million, right? It's very rare. But you cited data, this is like 1 or 2 in 10.
Yeah, exactly. So I haven't seen the numbers like this with any other virus, I can tell you that much. And so it may be 10%. That's kind of the best estimate we have right now. The lowest estimate we've seen is 2.3%. So even that, if you just look at the raw numbers, we're looking at thousands of patients right here in our own community that are probably suffering from long COVID symptoms.
Yeah, so if you don't die, you can still feel like you just got whacked because you feel so darn bad. And I think what we have to make people understand is it's not just about you're getting sick with COVID and could die. You're getting sick with COVID and you could be sick for a very, very, very long time.
Kim wants to know if you're vaccinated and you received a transplant, wearing a mask, but others around you who are also vaccinated are not wearing their mask. Is Kim safe?
Here's what I would say. I think you're always safer to wear a mask if you're post-transplant when there's infectious diseases in the community. And by the way, that's something that transplant patients have been doing this for years. This is not new. It's not just a COVID thing. I in my lung transplant follow-up clinic, we follow a lot of patients who are transplanted at Barnes, and I'll just say, they're telling these guys, look, you wear a mask. If it's first year, you have to wear a mask because you're so immunosuppressed. As they back off your immunosuppression a little bit, then you may not be able to. You can kind of stop wearing a mask, but the first rule is if you go out into a crowded public space, if you're going to fly on a plane, or if there's a prevalent virus in the community, put your mask back on. And actually, they should wear their mask out in the community for the rest of their lives. So for a transplant patient, this isn't really new, Hawk.
Yeah, I agree with you. I think the official guidance based on expert opinion for any of these societies, and by that I mean the Hematologic Malignancy Society, like the Blood Cancer Society, the Solid Organ Transplant Societies, anybody else that deals with immunosuppressed patients, liver doctors who deal with patients with cirrhosis, the guidance is right now based on expert opinion and what we know from the data is even though you're vaccinated, you need to continue to take those precautions, just as you said, Steve. Continue to wear a mask and distance as much as possible because we know even if you are vaccinated and you are immunosuppressed, you are still at risk of some of those adverse outcomes.
Robin is asking, where can she get a free COVID test in Wyandotte County?
I don't. Do you know that off the top of your head, guys? I don't know.
I would start with
probably the public health department.
Health department. Yeah,
Wyandotte
Right.
County Public Health Department would be number one. Number two.
The
number
tests are
three.
free.
Yeah.
Yeah, they're not. I mean,
So-
you pay a fee over at CVS or whatever, but don't you pay it? I think at the drugstores. But if you go with the Wyandotte Health Department, they're not going to charge you.
Yeah, I would start with them.
Also,
right.
Vibrant Health. And you might talk to Vibrant Health. I think they
Yeah.
probably are doing that as well.
Right. Kelly says, is the Delta still primarily transmitted by breathing it in or is part of the higher transmissibility due to touching items, surface contact?
Yeah, I don't think we have any indication that it's those inanimate objects and touching things. We always advocate for good hand hygiene, so frequently using hand sanitizer or washing your hands. But the mode of transmission continues to be those respiratory droplets.
And Jean asks, have you seen the Israeli data showing the decline in effectiveness of the vaccine with time? It shows 16% effective for infection for those vaccinated in January.
You'll have to see. I know there was a big hubbub about some initial data that came out originally from Israel. Again, remember, this is an observational study. All the other data we have still suggests that there is an 85% or more effectiveness against, number one, symptomatic disease, but also especially against severe disease and hospitalization for infections with Delta variant.
Yeah, I said the data that Pfizer presented to the FDA, and the FDA talked about at the CDC Advisory Committee last week, was a decline in effectiveness from 90% to 80% at 6 months in certain disease, in certain populations, not in everyone. So I would be careful with did you say 16%? I had not seen that from the Israel data. We'll have to look that one up. I know what was presented to the FDA and CDC in the last week was a decline from 90 to 80, but it was also in very specific disease segments of the population, especially those over 65. So I think we may see a booster come about. Now, that, to be honest with you, we have to be careful. What's declining in effectiveness? There appears to be the antibodies go down a little bit, but it's also the risk of hospitalization and death. By the way, 80% is still incredibly effective for a vaccination. Remember, the influenza vaccination is about 55 or 60%. So 80% is still very, very darn high. But also what it suggests is some of the Israeli data, I think, is that third booster really pushed your antibody levels really high. And so I'm going to guess we're going to end up with a booster. I don't know if it's going to be for everyone, but I'm going to bet it's those over 65 or those at really high risk with immunocompromising diseases with severe chronic illness.
Yeah, and I think there was that New England Journal article that came out last week that did show still good protection against really Delta. And then we also, I believe, that Lancet article about the Scotland data. Vaccination still prevented hospitalization and severe disease in that cohort of people from Scotland. So, and a lot of that was Delta variant as well. So.
Megan says it gets really scary when the local hospitals are at full capacity. Where are people going to go?
Mm-hmm. Yeah, that's a great question, Megan, and that's our concern, by the way. That's why we've come out. You've heard me blab on about how we need to have masks back on, and the reason is because of I want you to be safe. We don't want to have to see you suffer, as Heather has truly suffered from long haul syndrome, and also. When we get full, we have a hard time offering care to everyone. And the struggle is this. It's not that we don't want to. It's that at some point you hit your capacity, you don't have a bed, where are you going to put that patient? And that's where we are and where I think Kansas City is in general. Everybody's really full right now. And we're full because of just seasonal variation in hospital census, which can go up and down. Second of all, as we've mentioned, a lot of RSV and parainfluenza out there. It's making all ages sick, not just kids. But third, we're full with COVID again. And, when we have, do we have 250 patients like we did at the height of the pandemic back in November, late November, early December? No, we don't. We are at 60. And that's a lot smaller number. Thank goodness. Keep your fingers crossed. Let's hope it stays there. Or actually, let's hope it goes down. But at the end of the day, if you don't have beds and you've just added 60 patients, you don't have beds because everybody's sick or because your staff are out sick or what have you, then when you add another 60 patients into this very busy hospital, then it just makes it harder and harder to find beds for other folks. And so I think that's the problem. Do I think anybody in Kansas City is truly being denied care? I haven't heard that yet. We're not accepting as many transfers from outlying hospitals. You get in the emergency room, we're going to take care of you. But if from outside hospitals, we're not taking those transfers. And that hurts our heart because some of those folks are really sick and they could use our help. But we just don't have beds to put folks in. So I think we're at this precarious point. That's why I would like to see us going back to masking because the Delta variant is rising. We have to take care of each other, and we got to make sure everybody gets vaccinated.
Mary asks, is there any evidence that the post-COVID symptoms are caused by continuing active virus? What's causing these post-COVID symptoms?
Yeah, that's a fantastic question. So there's a lot of different theories out there. This is being actively researched, and so one of those is that there's still some active virus, or maybe there's a viral reservoir that's still there. Dr. Hawkinson may be able to speak more to that. There's a lot of interest in the immune system and having some dysregulation of the immune system that's causing a lot of these symptoms. And then there's others. We know that COVID can increase your risk of forming blood clots, so maybe some are blood clots in small vessels muscles in particular. So there's a lot of different possibilities out there, maybe a combination of all of that, but that's what's being studied right now.
Yeah, I would agree. I think the leading theory is, just as you said, is more of that immune dysregulation. And maybe when you get that vaccine dose or those 2 doses, it helps to reset that immune response. Maybe there's some ongoing inflammation. One of those studies that also is there an autoimmune type response? One of those studies that we're looking at that showed persistent symptoms after a full year after COVID did show some increase in the ANA, which is just an antibody you look at, and can be associated with some autoimmune effects as well. I haven't had a chance to talk with our rheumatologists about that yet, but there is probably more of that active, ongoing inflammatory process.
We have so many great questions, and I know we're running out of time. Here's one from Melissa, and if Dr. Stites and Jessica will permit me one more, I'll do one more after this. Melissa's saying, we all had COVID last year. My husband was hospitalized. My youngest was very sick. We've all had a little bit of long haulers. And she's writing because she's worried about her kids that are too young to be vaccinated, have to go back to school, and if they will be protected if she makes them wear a mask, even if those around her are not masking.
Well,
They don't want COVID again.
Yeah, Hawkeye, I think the answer to this is that masking is really protecting others from your secretions. So that's really how it works most effectively. But it does offer some protection from breathing things in. So I think that I would say, yeah, wear a mask, and it does reduce your risk of transmission. It's not going to make it go away, but it really reduces it significantly.
Yeah, I totally agree. You know, one of our main points early on was that masks help provide a barrier so that you're not expressing a lot of virus out to the environment. But just as you said, it does offer that benefit, a little bit of benefit against you breathing in those respiratory droplets as well.
Maybe we need to go back to the freezer and prove this point. It might feel pretty good when it's 95 degrees outside. I may not mind it.
We could pull out an oldies but goodies list. I think they're pretty close by. I do want to let Heather know that a lot of people on the line are applauding her coming on and telling her how many people that she is helping and how brave she is, and to continue sharing her stories. Mallory just wants a clarification from the Long Haul Clinic, and this is the last question. To clarify, have the patients that were vaccinated prior to getting COVID, are they the ones that are having long haul symptoms?
So so I think the answer to that is no. So we have not seen anybody in our clinic who was vaccinated and then got COVID, so these breakthrough infections, and then get long haul. So we have not seen that yet, and so I think it's pretty clear to us that the vaccine is quite protective, both against acute infection, but also with long hauls.
All right, Jill, thanks so much. Thanks for those great questions today. We'll hang on to them. Do you have another one?
No, but I'm just saying, I want to recognize that people thank you. The docs are back, and we are just going to talk COVID until we get through this surge. So,
all right, you're on. Sounds good. Okay, final thoughts. Heather, I'm going to let you get us started.
Yes. So I'd say my final thoughts are to listen to your medical professionals and do everything you can to prevent the spread of this. That can, you, like they said, you may survive it, but it doesn't mean you're not going to have a debilitating year following having it. Protect our children, especially the ones that can't have the vaccine right now, and just continue to be safe and think of others, and do the right things, such as, keeping your distance and masking up in large crowds, and just really think about your overall health and how you want to spend your next year, not in and out of doctors' offices.
Heather, thanks so much for reaching out to me. I appreciate it. We appreciate you coming on. We'll stay in touch for sure. Dr. Comfort, final thoughts?
So the best way to not get long COVID is to not get COVID. And the best way to not get COVID is to get your vaccine and do what Dr. Hawkinson and Dr. Stites have been saying all along. So wear our mask, social distance, do all those things that we know works.
Dr. Hawkinson, we haven't heard your final thoughts in a while. What do you got?
That's good. I just want to thank Dr. Comfort. He's been so good. Him and Leslie Spikes have really directed this long COVID clinic, and it's a multidisciplinary clinic, and really looking to help people. To Heather's point, very good messaging. There's really nothing to add. Protect yourself, get the vaccination, protect your children or other children you may know who don't have the ability to get vaccinated, because you don't want them having those long symptoms, those long COVID symptoms either. So really nothing more to add to Heather's great message.
All right, Dr. Stites, your words of wisdom as we head out today.
I do. Actually, I have some questions for our listening audience. I want you to ask yourself this question, especially if you're not vaccinated. What proves reality? What tracks reality? Is it the virtual fiction that is on the internet that has no basis in scientific merit and that is not proven? Or is reality based upon the observation of what we see here in the hospitals every day, where young people are dying from this disease that is almost entirely preventable? You heard Heather's story. Heather, first of all, thank you. And it is such a blessing for you to come on this program and let us know where you are and how this has affected you. And I would say this to all the patients out there whose lives have been affected by COVID. Please keep helping tell the story of the real reality and not the one that's made up. And then we have to ask ourselves the second question. Who and what are we mad at? Are we really mad at each other? Does that really make sense? Should we be mad at each other about COVID-19? Or should we be mad at the darn virus? Well, what's the point of being mad at each other? None of us want this. None of us like it. So isn't the real point to beat the virus as opposed to beating up on each other? So let's beat the virus and let's believe in the reality and not the virtual, false, fictionalized news network, because the made-up news network isn't going to save your life. What's going to save your life is a very simple act. Actually, two simple acts. One, put on a mask, and two, get yourself vaccinated. It's going to save your lives, the lives of the people you care and love, your children, and it's going to prevent you from things like long-haul syndrome. So even if you survive, you don't have to survive with misery. You can do better. We can do better. And all we have to do is take care of each other.
Love it. Thank you. And thanks, everyone, for being with us today. We appreciate you being with us and sending in your questions. Tomorrow, open mics with Dr. Stites. He's back. We're going to answer all your COVID questions and also reflect on rural health care in this time of COVID. So that is tomorrow morning. We will be back here at 8 a.m. Have a great Tuesday.